Hello, everybody. This is Gary. Today is May 8th, 2022. It is 3:55 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm doing pretty good. I went out food shopping today, did a few chores, did some work on my computer. Now I'm making this video. I haven't made a video in a couple of days. It's been kind of hectic. I'm trying to get ready to have surgery on Friday on my knee because I have a torn meniscus and loose cartilage. My right knee has been in a lot of pain for about 5 months. And I have a COVID-19 test tomorrow. Assuming it comes back negative, we will go ahead with the surgery on Friday, which is May 13th. I would like to get this over and done with. My knee's been in a lot of pain for quite some time. I was also suffering a lot of musculoskeletal pain throughout my body, nerve pain throughout my body, and joint pain throughout my body, a lot of it from arthritis. And Cymbalta has helped release some of that pain, as well as Neurontin, Flexeril, Aleve, and Tylenol. I'm not taking any opioid drugs for pain. Those are not given out very easily anymore. At least they shouldn't be. When I have surgery, they may give me a few days supply of opioids. When I had surgery about 4 or 5 months ago, 6 months ago, on my bladder, they gave me some oxycodone, about a 3 or 4 days supplies worth. Nothing really to get hooked on. That's what they'll probably do for my knee surgery. I'll use it up and then I won't ask for any more because I don't need it. I expect my right knee will be painful, but I have no desire to take opioids for a long period of time. Opioids were never my drug of choice when I was using drugs. My drug of choice was speed, amphetamine, Ritalin, appetite suppressants like phentermine, that kind of thing. Was never into cocaine. Cocaine never did much for me, even though it is a stimulant. And personally, I haven't used illegal drugs in about 8 or 9 years. And I don't drink. I haven't had a drink in at least 5 years. And I quit smoking about 3.5 months ago. I'm still using nicotine lozenges because, oddly enough, nicotine is one of the hardest drugs to quit. I'm just concentrating on staying away from cigarettes. I'll quit the nicotine later on. But as far as my psychiatric symptoms today, they're going okay. My paranoia isn't as bad as it's been in the past 3 or 4 days. It was pretty intense. I thought people were following me on the bus or at the bus stop. My auditory hallucinations are pretty much minimal today. They're there, they're always there, but they're at a level where I can ignore them. When I say them, I don't mean they're actually real people. I don't believe that. But I can certainly hear the voices as clearly as if somebody was talking to me from outside of my head. They're not voices in my head. I can hear them audibly through my ears. My anxiety levels are pretty high just because I have a lot to do to get ready for surgery and there's a lot going on. I had to make sure that I got all my supplies of my prescription medications, my over-the-counter medications, make sure I have food in the house, make sure my apartment's clean. They're inspecting apartments this week in my building and they're picking apartments randomly to inspect so they don't know which apartments are going to be inspected. They only told us that the inspections will be coming through May 9th, May 11th, 2022. So my apartment may or may not be inspected, but I cleaned it anyways. I don't want to get evicted for anything. So there's a lot going on, a lot of stressors, primarily worried about the surgery. Arranging transportation is difficult. Making sure I have everything in my apartment. Because if it's knee surgery, I don't know how painful my knee's going to be when I walk on it after surgery, so I may not be able to go out for a few days. And I just want to make sure I have all the supplies I need in my apartment while I'm down. on downtime. I've never had surgery in my legs, my feet, my knees, so I've never had a bear weight on any part of my legs after having surgery on my legs. Certainly, when I had my bladder surgery, my abdomen hurt because they put in 5 or 6 incisions into my abdomen for the operating instruments run by a robot to work on my bladder, and I certainly had pain in my abdomen for quite some time, my stomach area, but I didn't have to bear weight on it. With my knee, I'm going to have to bear weight on it because I have to walk on it. So I don't know how intense that pain is going to be or how long it's going to last, and if I'm going to be able to walk far distances or not after surgery. But so my anxiety levels are pretty high. My depression isn't that bad, and like I said, the paranoia is not that bad, and the auditory hallucinations today are not that bad. So I'm doing the COVID test tomorrow. I'm seeing my therapist on May 10th. I haven't seen her in a while because 2 weeks ago I had a COVID-19 test and it came back positive. I had to cancel my surgery, which was scheduled for April 29th. I was supposed to see my therapist a couple of days before that, and I had to cancel that because I was COVID positive. So I'm just hoping that tomorrow's test comes back negative, so I could just go ahead with seeing my therapist on Tuesday and doing the surgery on Friday. I did see my psychiatrist last week on Thursday. He increased my Zyprexa by 5 milligrams from 10 milligrams a day to 15 milligrams a day to help me deal with my paranoia. When I think people are following me or spying on me or talking about me or laughing at me. So that's the only medication change we made, was increasing my Zyprexa, and everything else is going okay, and there's nothing much else to report on.